So one of the problems that I've always had with studying over the last several years, all the way from pre-med, med school, and residency, is that I tend to study a topic once, but by the time exam day rolls around, I quickly forget all about it. But what I realized was it's not that I have a poor memory or that med school is probably not right for me. It's that I actually don't have a good understanding of the topic I just studied, and I had no idea what my weak areas are. Now, one solution to this problem is to find a way to deepen your understanding of a topic by pinpointing problem areas. And that is the idea of the Feynman Technique. And in this video, we're gonna go through what is the Feynman Technique, how to use the Feynman Technique, and when to use it, and finally, I will walk you through an example of how you might use it in your studies. So let's get into it. Part 1. What is the Feynman Technique? Now, this learning method is named after Richard Feynman, who is a theoretical physicist and was awarded the Nobel Prize for his work in quantum electrodynamics. And the principle is quite simple. If you want to deeply understand a certain topic or find out where our knowledge gaps are of a certain subject, we have to try and explain it using the simplest terms. As the quote that's frequently attributed to Albert Einstein goes, if you can't explain it simply, you don't understand it well enough. And by doing this technique, you'll be able to spot your weak areas, which is where you get stuck in your explanation or when you're already using medical jargon or terminologies. And after you identify your weak or problem areas in that subject that you're trying to learn, you can then use a sort of targeted and narrower approach to more efficiently study those topics. Now, how do you use it? Now, the Feynman Technique is based on the general idea of explaining a complex or complicated concept in simpler terms. Now, for example, you can explain it to a friend that you're studying with, but we don't always have a friend or someone nearby when we're studying for exams. So, an alternative method is to either get a piece of paper to write the concept, or what I usually do is I talk to myself out loud when I'm doing this technique, because I find that if I write it on paper, it takes up too much time and energy to do. But it really depends on where you're more comfortable. Now let's go to the 4-step method of doing this technique. Now, step 1 is to choose a topic and understand it first. Now, it goes without saying that before you try and explain a complex topic in simpler terms, you have to understand the study material first. And understanding a complex topic means reading and studying your handouts or textbook. But if you feel stuck and you can't seem to understand the words in your book, you can try to watch YouTube videos first that explain the topic, like for example Ninja Nerd, which has videos on almost every medical topic that you will probably find difficult to understand on your first reading. So it's good to check that out. Now, step 2 is ELI 5, or explain like I'm 5. Now, you might be familiar with this social media acronym, but the point is to imagine or pretend teaching the topic to a 5-year-old who has basically zero base understanding of it, and using plain and simple terms. And remember, no jargon. Now, step 3 is to assess and target problem areas. Now, as you're trying to explain it in using simple terms, you'll begin to pinpoint certain problem areas or parts where you're still having difficulty trying to explain it in a simple way, or parts where you're using complex terms or using medical jargon. Now, these are what we call knowledge gaps. So in this case, we have to read and study more to fill those gaps. And you can do that by going back to your textbook or lecture handouts and try to read on and study it again. So what you're now doing is a more targeted approach to studying, instead of rereading the whole material from the beginning, which will take up a lot of your time. Now, step 4 is review and simplify. Now that you've already explained the concept in hopefully simple terms, now go one step further and try and explain it again. But this time, use the knowledge that you got from when you went back to your study materials, which you did in step 3. Because now, you have already filled in most of your knowledge gaps. And that's basically it. Now we go to part 3, which is when do you use the Feynman Technique? Now, another thing to remember is you don't have to use this on every piece of information that you're trying to learn, because there will be information that's readily learned or understood, or what we call intuitive knowledge. And there's also the opposite of it, which is non-intuitive knowledge. Because if you use this for everything, it will use up a lot of your time that you can use instead to do practice questions and studying the explanations, which is also one of the most effective study strategies I often use a lot. Now, personally, I use the Feynman Technique for topics that have multiple interconnected concepts, or those that I have a hard time understanding, like when I'm studying the stages of labor for obstetrics, or when I'm studying biostatistics concepts. because I'm the worst when it comes to numbers, so I have to put more time and effort in understanding it. But one of the best subjects to use this technique is in physiology, because in studying physiology, you have to start with knowing the general idea first of how things work, and then once you get to know the big picture, only then will you be able to focus on the finer details. So ultimately, one of the key principles is to just find out when to use it. I also don't use the Feynman technique if the topic requires memorization, like for example, memorizing the drugs that are known as cytochrome P450 inducers and inhibitors. Now these kinds of information are what's known as non-intuitive knowledge, because the list of drugs, as you can see, don't seem to have a common characteristic to them, or they don't have a sort of pattern for being included in the list in the first place. So in these instances, I would rather use the method of loci or the memory palace to memorize this list. Now, to give an example of how I would use this technique, let's try and see how I would use this to understand the tubuloglomerular feedback mechanism, which works to maintain constant blood flow into the kidneys, or what we call autoregulation. Now, it says here from Guyton that tubuloglomerular feedback happens when decreased GFR from whatever reason, like for example, decreased effective circulating volume from hypovolemic shock, like massive bleeding, it reduces the concentration of sodium chloride at the macula densa cells, which leads to decreased resistance of the afferent arterioles and increased renin release. Now, the way I would try and use the Feynman technique here is, after reading this, I would first ask myself, why is it even named tubuloglomerular feedback? Well, it's because it's a feedback mechanism involving a special set of cells called the macula densa, located in the distal tubules, tubulo, and it sends signals to nearby structures to influence the activity of the glomerulus. Glomerular, tubuloglomerular feedback. And then I would proceed to explaining that whenever blood flow to the kidneys decreases from reduced blood volume, for example, when there's massive bleeding for a leg trauma, there will also be a decreased amount of filtrate, which is the fluid that's already passed through the glomerulus, coming to the distal tubule, where the special cells called the macula densa are located. Now, the macula densa senses this decreased amount of filtrate and sends signals to nearby structures like the afferent arteriole to release an enzyme called renin. Now, this enzyme from the afferent arteriole called renin plays an important role in facilitating the RAS, which you can see here. But we won't be going to the details of it here because that would take maybe another 10 minutes to go through. But basically, renin sets up a cascade of chemical reactions to produce angiotensin II, which then acts here to constrict the efferent arteriole, which then leads to increased glomerular pressure and helps to bring the blood volume to the kidneys back to normal levels. So as you can see, the simpler the explanation, the more likely I would be able to understand it. Now, the important thing is to get the general idea or the big picture first of what's happening, and then you can fill in the details after that. And as you can notice, I first tried to understand why is it named tubuloglomerular feedback in the first place, and I also tried to put simple definitions on certain parts, like what the macula densa is and where it is located. So the point is to avoid the use of jargon early and to keep it as simple as possible. Now, this explanation of the tubuloglomerular feedback mechanism might not work for other students watching this, but the important thing is this works for me, and this is one of the most crucial parts of the technique. It must work for you. You must understand the explanation you created for yourself. Thank you so much for watching, and do hit the subscribe button if you haven't already, and see you in the next video. Bye.